My specific area of expertise is atrial fibrillation. I treat patients by seeing them in clinic and decide whether they need medications or procedures. I love understanding patients where they are. So I love to learn about who they are and what they do and what their life was like before they had the disease. A lot of my work is focused on patient experience when they're not in the clinic and how they do when they leave the clinics. I spend a lot of time trying to understand other factors that influence their experience of disease. And I'm interested in utilizing technology and leveraging technology to try to understand how the disease begins and how it progresses and how our treatments affect their patients' experience of disease.